Hi, my name is Sarah Beth Carrata, and I am a student at Liberty University Online, pursuing my master's in public health with the nutrition concentration. I will be discussing with you my practicum experience and what I learned throughout my project. Next slide, please. I partnered with an organization called Least of These, which is a part of World Gospel Mission in Kenya. Least of These works with over 500 orphans and vulnerable children, doing healthcare and education to children in and around Nairobi. Some places that Least of These works with are children's homes, special needs schools, HIV and AIDS clinics, children's centers, and abandoned baby centers in 9 places in Kenya. Also, Least of These educates the children on spiritual truths through Bible stories, coloring pages, and spending quality time together. Each children's center has caregivers who are in close contact with the children. Their roles consist of taking care of the children, social work, or administration of the children's centers. The problem is that the caregivers and children at some of the children's centers in Kenya may not understand components of a healthy diet. They also may face barriers to assessing elements of their healthy diet. So the purpose of my project was to evaluate the children's centers Least of These partners with on components of a nutritious diet and what barriers they face in assessing at least 4 or 5 food groups a day. Next slide, please. Throughout this program, 5 competencies were addressed. The first competency was to assess population needs, assets, and capabilities that affect communities' health. The way this was completed was by visiting different children's centers and addressing their population needs. The second foundational objective was to design a population-based policy, program, project, or intervention. This was finished by creating the project that assessed the nutritional options available at the children's centers and also by integrating different policies. The third goal was to perform effectively in interprofessional teams. This is fulfilled through working amongst a team of nurse practitioner, physician assistant, and a teacher by visiting the homes and assisting the caregivers at the children's centers. The fourth objective applied principles of nutrition to health promotion and disease prevention. This was done through the nutrition intervention of a healthy, well-balanced Kenyan diet. My last goal applied the Christian worldview to public health practice in diverse settings and populations. The organization Least of These is a mission organization in Nairobi, Kenya. They organize medical clinics, education, and public health in and around Nairobi, Kenya. At the end of the medical clinics, an interactive Bible story for children in the centers was done. The goal is for the children to not only be helped physically, but also spiritually. Next slide, please. I arrived in Kenya on August 11, 2019, and started my practicum on August 19, 2019. I have been in Kenya for almost 4 months and will be returning to the United States on December 17th. This qualitative study was completed among 5 children's centers. Center A and B are in rural areas just outside Nairobi. Center C was in the Nairobi metropolitan area. Center D was located about an hour outside Nairobi. Center E was located in a rural town in western Kenya, about 3 hours outside Nairobi. The nutrition among children in Kenya included semi-structured interviews, and also data was collected from the children and the caregivers at the various children's centers. The children ranged from birth to approximately 15 years old at the centers represented. In order to improve understanding of a Kenyan healthy diet, a semi-structured interview was completed with at least 2 caregivers at each center in Kenya and verified their understanding by placing sample foods into their appropriate food groups. According to the Ministry of Health, Kenya has 7 food groups. The 7 food groups are as follows. Number 1, starchy foods. Number 2, fruits and vegetables. Number 3, legumes and pulses, nuts and seeds. Number 4, meat, fish, and animal protein products. Number 5, milk and milk products. Number 6, fats and oils. Number 7, sugars and sweets. The pictures you see are of the post-test the caregivers had to place into its proper food group. In addition to the semi-structured interviews with the caregivers, the children were taught at the various centers about how healthy foods, the attributes of God, and a Christian life relate. The fruit of the Spirit was taken from Galatians 5:22 and 23, which is in the Bible and states, "But the fruit of the Spirit is love, joy, peace, patience, kindness, goodness, faithfulness, gentleness, and self-control. Against such things there is no law." Each of the components of the fruit of the Spirit were taken with a fruit and have a fun children's song to go with it. The activities done with the caregivers and children were included a 20-minute interview, semi-structured interview with the caregivers to discuss their knowledge and educate them regarding a healthy diet, teaching public health practices to the children of the centers through skits and visual aids, and also incorporating the attributes of God and characteristics of a Christian life with nutritional principles. Next slide, please. The caregivers verified they knew the information presented to them by manipulating the different foods into its various food groups. 14 foods were used. They were supposed to receive at least 75%, which breaks down to about 10 out of 14. All of the centers greatly surpassed that. Look at Table 1 for a breakdown of the results. Centers A and D received 14 out of 14. Center E received 13 out of 14, and centers B and C received 12 out of 14. Each of the children's centers represented had various number of children, ranging from 25 to 80 children. Refer to Figure 1 for a breakdown of the centers. Center B had the most with 80 children, and Center D had the least with 25 children. The average number of children represented is about 44. Next slide, please. While talking to the children, they were all very engaged. Each fruit of the Spirit has qualities that should be evident in the life of a Christian. A fruit or vegetable was selected to associate the characteristics of the fruit of the Spirit. Foods used were a passion fruit, orange, watermelon, pineapple, pumpkin, banana, avocado, mango, and apple. Look at the picture provided to see which fruits or vegetables were used with each of the fruit of the Spirit. A memory tool was created for each fruit of the Spirit. It was also explained that if a person were to only eat one food item, like ugali, for their whole life and nothing else, that they would not grow healthy and strong. Ugali is a Kenyan staple made from cornmeal and water and has the consistency of a grainy dough. When talking among the caregivers, one question asked was, what are the barriers for you not accessing all the food groups? Centers A, B, and C had a similar answer to not having the correct amount of funds available. Center A's main barrier is not having the funds available because of the vegetables not in season are more expensive than the vegetables that are in season. Center B identified because of the rain, droughts, the number of children, and poor milk production by cows as its barriers. Center C overall just identified finances, and centers D and E do not have any barriers to assessing all the food groups. After asking about the barriers, they were asked, how do you think you can overcome these barriers, and how are you taking steps to overcome the barriers? Center A explained growing more types of a variety of fruits and vegetables. Also, they developed a monthly budget with specific foods. Center B stated they should get better water, try to grow carrots, and see about planting a fruit tree. Center C expressed growing other fruits and vegetables in the garden like onions. Center D is almost entirely sustainable on its own. As long as the rain keeps up, they should be fully sustainable on their own by 18 months. Center E receives much food from church donations and volunteers. Next slide, please. The centers should continue to feed the children 4 or 5 food groups a day, feeding them enough food, but not too much food of each type. Foods should be nutrient-dense, eating well without overeating. Some foods should be consumed in moderation, like fat and sugar. Food should be prepared, stored, and served in a hygienic environment to prevent contamination. When possible, drink plenty of safe water. Next slide, please. Nutrition among children in Kenya is a widespread problem. Many children in Kenya are orphaned, abandoned, or left without a home, so they attend children's centers. Caregivers at the children's centers are in close contact with the children to help the children with their daily needs, emotional support, love, and care. Through a semi-structured interview with the caregivers and nutritional education to the children, a healthy, well-balanced diet was discussed. Barriers were examined with why the children at the centers were not able to access all of the 7 food groups. One goal of helping the centers was not only physically, but also spiritually was met. By bringing the Bible to light with the fruit of the Spirit, the children and caregivers began to realize that even though certain fruits and vegetables are available for a person to grow healthy and strong, the fruit of the Spirit was presented to help them know the qualities of Christian living and the attributes of God. Next slide, please. On this slide is the references used for my presentation. Thank you so much to Liberty University. Without you, I would not be in the position I am in right now, doing public health. I am looking forward to seeing what's in store for me within the field of public health. Thank you.